Good morning, Minnesota DFLers, and welcome to the DFL Daily. Richard Carlbaum here, chair of the Minnesota Democratic Farmer Labor Party. We're here every day at 10:45, giving you the message, the action, and the tools to take one more concrete step toward winning big in 2026, the midterm election. A couple of gatherings happening this morning. The Common Good Coffee Club is underway in Scandia. Similarly, the Beltrami County DFL is hosting a coffee and conversation right now. The Rally for Your Rights is in Apple Valley at 4:30 today, and then the Hubbard County is having a social gathering in Park Rapids. I, of course, will be up at the CD6 dinner tonight. Excited to hang out with CD6ers and support Doug Chapin for Congress at their annual dinner. You can go to dfl.org/events to find out what is happening around the state and near you. Today, we're going to be talking about the real connection between healthcare and democracy. We've talked a lot about how Republicans have made healthcare costs explode, which they have. In Minnesota, if you get sick and you can afford it, you can call a doctor, you can show up at the clinic, and you can make your own healthcare decisions. But the truth is, costs are out of control because Republicans voted for the big ugly bill, while Democrats are fighting to bring costs down and make healthcare more affordable. And also, all healthcare decisions should be yours and only yours to make. In Minnesota, a woman can make her own decisions about her own body because Democrats led. A family can work with their doctor on what care they need because Democrats led. And a patient can get cancer screenings, follow-ups, and basic care without fear of losing their health insurance because Democrats led nationally on health care. We trust people to make their own decisions. We trust doctors to work with people to help them make the right decision. We believe in keeping politicians out of the exam room. They belong. That space belongs to you, your family, and your doctor. No one in government. Not the government, not a politician in St. Paul or Washington, and certainly not RFK Jr. None of those people belong in the exam room. Only you and your doctor. And that's not a radical idea. It's just freedom. And that's why it's so important. Today, I wanted to highlight when Minnesota got a glimpse to the other possibility of when government impacts the ability of you to make your own decisions and to actually get health care.
ICE's occupation of Minnesota has created unsustainable working conditions for doctors and healthcare workers alike. Our patients are terrified to come into our clinics and to come into our hospitals. They are not getting their medications. They are not getting their treatments. And what's worse is when they're here, they're seeing patients detained and shackled to their beds. ICE is invading our daycares, our sacred places of home, of our hospitals, our gathering spaces. They must leave Minnesota. They're destroying our community.
Yes. Get out.
I want to share that I am a native Minnesotan. I grew up in Minneapolis, and the running joke at my medical school was I was that Minnesota girl because I was going to come home and practice medicine here. I love Minnesota, and it is breaking my heart to see us terrorized by ICE. Their brutality is unmatched, and I cannot stand to witness my patients being violently brutalized by ICE on the streets and outside of our hospitals. We demand that ICE leave Minnesota and leave every hospital here for the safety of our community and our patients. Yeah. We are here to stand in solidarity today, harkening back to the Union State that is Minnesota, back to the general strike of 1934 and to the murder of We know how to organize in Minnesota, and we are here to do just that. We demand that ICE leaves immediately, and we demand for the abolition of ICE.
That, of course, was a video taken during the Operation Metro Surge when federal agents were here scaring our community, making sure people were staying home. And what happened is patients stopped showing up to appointments. Clinics saw an almost 10% spike in no-shows, and that meant people delayed care for things like basic health care, cancer screenings, follow-up care, not because care wasn't there or a politician made it illegal, because they were afraid they might be disappeared regardless of their immigration status. Think about it. Someone knows they need care. Maybe even they already made an appointment. They've already made a decision. But they don't walk through the door, not because of a doctor or lack of medicine, but because government made them afraid to get the care they deserve. Those are real consequences. Doctors have made it very clear about what happens next. When care gets delayed, procedures get more complicated, costs go up. In some cases, people skip follow-ups entirely. Even when there's a risk of serious illness, people are too afraid to come. Care delayed becomes care denied. And that's what Republicans are trying to do with our democracy, our health care, and our freedom. It's not always going to show up as a law on paper. It's going to show up as fear, as pressure, as inserting themselves into your daily decisions. And whether we're talking about abortion and reproductive care, gender affirming care, or any other personal medical decision, the principle is the same. Who should decide? It should be you and your doctor. Right now, Republicans are pushing for the opposite direction to make the fear we saw this winter the new norm. In Washington, they're trying to make care harder and harder to access, both due to costs and restricting access to certain kinds of care. They're coming between you and essential medicine that's been used safely for decades and overriding the doctors who prescribe it. And then here in Minnesota, Republicans are trying to roll back protections and limit the kinds of care people can get, including, but especially the care that families are making decisions on with their doctors, their own personal health care decisions. So let's be honest about what that means. More government control, more interference, more fear, more people falling through the cracks. That's not freedom. Democrats, of course, are going to continue to fight for what we have in Minnesota and the protections that we've hard earned here in Minnesota. We are protecting Minnesotans when it comes to keeping decisions between patients and their doctors, when it comes to protecting access to reproductive care, when it comes to protecting access to gender affirming care, and when it comes to standing up to politicians who want to take that away from families in our state. We've seen what happens when that freedom is threatened, and we're not going backwards. So your call to action today. Post the video we played on your social media. We need to continue reminding folks the damage that was done during Operation Metro Surge and how long it will take time to repair that damage. There are a lot of people who are sicker today because of Operation Metro Surge. Their cancer grew further along. They didn't get the help, the reproductive care they needed, all because of Operation Metro Surge, and we need to remind Minnesotans of that impact. All right, folks, that's it today. Thank you for joining us on this Thursday. We'll see you back here tomorrow at 10:45. We got 180 days until the November 3rd midterm election. We are building the largest electoral defeat of a sitting president in the history of Minnesota midterms, and we're doing it together. Thanks so much, and let's go win this thing.